The prohibition of the sale of alcohol in oil, restaurants and eateries and so on does not mean that people can now take their alcohol to those places. The spirit and meaning of it all is to stop socializing. That's the idea. The idea is to stop socializing and therefore preserving physical distancing. So it will defeat the purpose if we said that you are not allowed to do that, and then you go to the same place carrying your shukambili. No. Going forward, sausage bili, soda moja. It's a new norm. Sausage bili, soda moja. And if you go to another place, you do exactly the same thing. So I think that clarifies that particular aspect, because people have been telling me this morning that if we go to a restaurant with my own wine, am I okay? And I said, no, you are not okay. The idea is for no alcohol to be seen in any of those premises. And if you buy and you take home with a whole bunch of people, effectively transforming your home into a shabin or a karumaindo, you will still be contravening the regulations and therefore liable to punishment. Essentially because once you pass a certain number, as you know, the 15 number, then you are assumed to be a gathering with the consequent results. But I'm not saying that we are prohibiting you from walking into a supermarket and enjoying your kanywaji and at home. Subsequently, those supermarkets and those outlets such as big wines and spirit areas, which we have not closed, must not be converted into parking lot drinking sprees, where people go and park cars outside and start drinking. So we are hoping that Kenyans, and I pray that Kenyans will take this thing with the spirit that it is meant to be, that we are getting a lot of our young people turning positive as a result of the socializing that we have experienced and we have seen over the past 21 days. There are now more than 4 million cases in the United States of America. It took 98 days to reach the first million people. 44 days to reach the second million people. 26 days to reach the third million people, and 15 days to reach the fourth million. And as you have seen for yourselves, when we started off, we were growing at a very slow rate. What we have seen now is that in 21 days, we have virtually doubled our figures as well. With freedom of movement and increased human contact, that is what happens. Indeed, ever since we lifted the cessation of movement, our own numbers have surged. While our death remains relatively low compared to many nations, we expect them to steadily climb as well. It is a fact that we must be prepared for. So, what am I saying then? I am saying that back to the responsibility issue, please, and I'm imploring you, if you do not need to travel, if you do not need to travel up country, don't. If you can avoid visitors at your home, avoid them. If you can avoid visiting people, avoid it. If you can avoid closing in on people and being too close to them, don't. Don't, because science doesn't lie, and either do figures. We can and we should learn from others, where they have succeeded and where they have failed. By taking such steps, we will ease the burden on the government and also save our lives. I have seen people write articles. I saw another one in a foreign paper the other day, where one insinuates that by us telling people to take responsibility, then it means that the government is abandoning its people. I think that is a very foolish notion. Because by the end of the day, it is not the government. It's not a government issue, and we have repeated it here many times. This is an individual responsibility. It is individuals who get sick, and it is individuals who die. So I beseech you that even as we report on these things, let us report from basic facts. As I give you today's figures, I would like to call upon our public officers, our Nyumba Kumi, and policemen to be vigilant in enforcing the directives given yesterday by the President. And as you heard, the Inspector General of Police will be submitting a weekly list of establishments closed. My prayer is that you save your establishment. If you have a bar, please don't spoil your business. Please avoid being closed. It is not business as usual. The enforcement agencies have been attacked so severely because of relaxing on this issue. And I want to make it clear, this is a public health issue. It is not an enforcement issue. So going forward, it is the public health officers who are going to go around and withdraw your license and simply tell the police that this particular establishment doesn't have a license and is operating, and therefore the activities that they are carrying on with are criminally liable. Turning to our COVID-19 statistics today, 606 people have tested positive from a sample size of 4,888 samples. This now brings us to a total of 18,581 persons in a cumulative total of 284,500 tests. 583 out of those people are Kenyans, while 23 are foreigners. 409 are men or female or male, 197 are female. The youngest case is 4-month-old infant, while the oldest is 85 years old. The distribution in counties: Nairobi heads the list at 448, Kiambu 54, Kajiado 25, Machakos 16, Uasin Gishu 11, Nakuru 11, Kericho 9, Busia 7, Mombasa 7, Garissa now 6, Bomet 3, Nyeri 2, Narok, Nandi, Embu, Lamu 1, and Murang'a has also an additional 1. You will get the statistics of the detailed distribution of this. But in Nairobi, for example, Embakasi now has become a serious hotspot. If you are living in the Embakasi area, you need to know that Embakasi is a hotspot, and further measures may have to be taken as regards the containment of some of the fast areas that are growing way too fast. So, ladies and gentlemen, without much ado, I just want to once again thank the health workers, because 75 patients have been discharged from the various hospitals, and therefore they have worked so hard recovering some 7,908. And we want to say thank you very much indeed, and to continue the very good work that you are doing. Unfortunately, we have also lost in the last 24 hours some 14 patients from the disease, bringing our fatality to a total of 299, hitting the 300 mark. And my sincere condolences go to the families of those who have been infected.
The deaths that are reported today, 14 deaths, 9 of them had pre-existing conditions ranging from diabetes and hypertension combined, or either diabetes or hypertension. 2 of them had cancers, 1 had cancer of the bone, called multiple myeloma, 1 had cancer of the esophagus, and the other one had end-stage renal disease, or kidney failure. Out of the 14, 4 did not have any coexisting medical condition. And it behoves us, especially those who have coexisting medical conditions, to ensure that we consult with our clinicians and our health care providers to ensure optimum management of our conditions, such that even if you get COVID, then it does not put you at a risk of getting a serious form of the disease. I assure you that if you have a well-controlled diabetes mellitus condition or well-controlled high blood pressure, the outcome of COVID-19 infection in you may not be different from a person who does not have a pre-existing medical condition. So it is imperative that we continue to take our medicines and all the healthcare practices that we get from our healthcare providers to ensure we are in the best state of health.
You know, in this cold weather,